Hello, and thank you for tuning into the program today. I'm your host, Neal Howard, here on Health Professional Radio. Contraception continues to be a major part of the discussion about family planning methods. Our guest is board-certified OBGYN Dr. Elicia Harris, and she's joining us now to explain why it's important for women to have meaningful discussions with their healthcare providers about the subject. Welcome to Health Professional Radio, Dr. Harris.
Thank you for having me today.
Women's health is a very important topic, especially in the media. What should women be thinking about when it comes to contraception and family planning methods?
Yes, contraception is definitely a hot topic right now. And with all of the different forms of contraception available, this topic is also very confusing for patients when they're trying to decide what is the best method for them. I'm here today to provide a little bit of guidance about some important things I think you have a discussion with your healthcare provider about. The things I would emphasize are effectiveness, long-term health benefits and considerations, as well as the lifestyle considerations that might be important to you.
When you're starting the discussion with your doctor, how do you guide women in starting that conversation, getting, I guess, on the same level, putting the doctor on the same level as the patient, not you're the doctor way up here and I'm the lowly patient down here, tell me what to do? How do you get everyone on a level playing field so that there is meaningful dialogue about the best method for a particular woman?
That's a great question. So in my practice, when I have a patient come in to discuss contraception, we talk about her plans and her desires for contraception in the future. Does she ever want to have a child? Is she looking for a long-term contraception option? Is she looking for a short-term option? We discuss that there's permanent options, there's long-acting but non-permanent options, there's hormonal options and non-hormonal options. We also talk about the tiers of efficacy, and not all contraception is equally as effective. So it's important to understand that that top tier of efficacy that's greater than 99% effective contains permanent sterilization as well as long-acting reversible contraception. It's also important to note that, however, sexually transmitted infections are not prevented by hormonal contraception, so you also need to consider that when you're talking about contraception, because that's also a very important subject.
As far as the efficacy of different methods are concerned, when we're talking, as you said, some of those long-acting but not permanent solutions, are we talking about chemical medication solutions or surgical solutions, or are both of those methods equally as effective within their own class as the others?
Yes, you are correct. Long-acting reversible contraception and permanent sterilization are in that top tier of efficacy, meaning that they are the most effective options. Now, there's hormonal as well as non-hormonal options within both categories. And with IUDs, they provide coverage for 3 to 10 years duration.
Now, IUD, to most of our listeners, is a pretty common term. Just explain to our listeners briefly what an IUD actually is for those of us who may have some misconceptions.
An IUD is an intrauterine device. This is a form of long-acting reversible contraception. Again, they last a duration of 3 to 10 years, greater than 99% effective, and can be removed prior to the conclusion of that duration if you change your mind about when you want to start a family. The newest IUD on the market is Kyleena, and I'm here with Bayer Pharmaceuticals today to give you a little bit more information about Kyleena. Kyleena lasts a duration of 5 years, and again, highly effective, greater than 99% effective.
Now, is this a recently approved IUD, something different, or something just little known?
So this is a new IUD that is FDA approved within the last year.
What are some of the side effects, if any, of this new device?
So IUDs, if they're hormonal, can have some potential side effects. Like all contraception options, there are pros and there are cons. It's important that you discuss this with your healthcare provider because the side effects can vary depending on your medical history. So it's a great dialogue to have pertinent to the method that you desire.
When it comes to the age of someone who's planning a family, are some of these methods more or less effective depending on how old a woman is? If someone decides that they want to have a child, or maybe even their first child at, say, 40 years old, would you suggest, in their 30s that they go one way or another based on when they plan on having a child?
Mm-hmm. Effectiveness of contraception does not vary with age. However, a woman's fertility changes with age. So after the age of 35, our fertility as women starts to decline gradually. So the length of contraception coverage you might consider based upon your age, but know that the effectiveness is the same.
Are there any methods that can slow that process when it comes to the hormonal changes that deplete over time?
There are some hormonal methods of contraception that can alter your hormone levels, that can decrease some hormonal symptoms you may have as you age as a woman, but each person is a little different.
Okay. Now, where can our listeners go and get some more information and stay informed about available healthcare options for women who are planning a family?
Yes, so a great website is Kylena-US.com. And then also a website that I find to be very valuable for my patients when they're trying to navigate their health insurance coverage for the different methods of contraception is coverher.org.
Coverher.org. All right.
Yes.
Well, I thank you. Some great information, very useful, and I appreciate you speaking with us today.
Thank you for having me.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, with Dr. Elicia Harris. She's a board-certified OBGYN, and she's been talking about the importance of women having meaningful discussions about family planning. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, and be sure to visit our affiliates page when you visit us at hpr.fm.